Welcome to Maas Keezhapavoor channel. I am Dr.Aruna. Let us hear motivational quote. You throw a bucket of water on a rock and it doesn't do anything. You let a drop of water fall onto a rock every day and it creates a hole. Consistency beats intensity. What you are observing is inner surface of mandible. Just a trial I want to do as Anat race. It is trace as well. It will be an interesting one to trace the structures. Observe this groove is the Mylohyoid groove. What are the structures passing through this mylohyoid groove? The structures passing through this groove are the mylohyoid nerve and blood vessels. This is the mylohyoid nerve and this is mylohyoid artery. So, through the mylohyoid groove, mylohyoid nerve and blood vessels pass. Now, just think about the area supplied by mylohyoid nerve. Observe the slide. The mylohyoid nerve is going to supply the mylohyoid muscle and also the anterior belly of digastric. Okay, fine. When anterior belly is supplied by mylohyoid nerve, which is a branch of inferior alveolar, now let us think about which nerve is going to supply the posterior belly of digastric. Observe the picture. This is the posterior belly of digastric, which arises from the mastoid notch. Now we are going to compare the nerve supply for anterior and posterior belly of digastric. Anterior belly is supplied by mylohyoid nerve, whereas the posterior belly is supplied by the facial nerve. The facial nerve comes out of the skull through which foramen? Observe this image. There is a foramen between styloid process and mastoid process. That foramen is the stylomastoid foramen. So, between styloid and mastoid process, there is a foramen called stylomastoid foramen. This foramen transmits which structures through stylomastoid foramen. Two structures are passing. One is facial nerve, the other one is stylomastoid artery. Remember, facial nerve comes out of the skull, stylomastoid artery enters into the skull. This facial nerve gives a branch to the muscle posterior belly of digastric. Now let us trace about the posterior auricular artery. Why do we move to posterior auricular artery? See, the stylomastoid artery is a branch of the posterior auricular artery. That is, this is the stylomastoid artery that arises from the posterior auricular artery. Okay. Posterior auricular artery that arises from the external carotid. Now let us see, when there is one posterior auricular artery, there should be posterior auricular vein and posterior auricular nerve. Look at this picture. There is a posterior auricular vein which joins with posterior division of retromandibular vein. These two unite to form the external jugular vein. This external jugular vein crosses the sternocleidomastoid muscle and finally drain into the subclavian vein. Let us see the posterior auricular nerve. This posterior auricular nerve is going to supply the occipital belly of occipitofrontalis, and the posterior auricular nerve arises from facial nerve. So, we have seen posterior auricular artery, posterior auricular vein, and posterior auricular nerve. Just a conclusion, posterior auricular artery arises from external carotid artery, posterior auricular vein that unites with the posterior division of retromandibular and forms external jugular vein, posterior auricular nerve that is a branch of facial nerve. Let us conclude the session. Turn criticism into motivation. Every time someone pulls you down, let it become a reason for your rise. Thank you for watching.